Hello, everyone. Welcome to back my channel. I hope everyone is having a wonderful day. Before starting the video, please go ahead and hit the subscribe button and give this video a thumbs up. 1,000 Pound Sisters Season 7 is in full swing, and there are signs that Brittany Combs will have a weight loss operation soon. Inspired by the rest of the Slatton siblings, Brittany's finally ready to embark on her own weight loss journey. The show is mostly about the weight loss journeys of Amy Slatton and Tammy Slatton, but several of their siblings appear on the show as well. Their brother, Chris Combs, is married to Brittany, and they've both become fan favorites over the years. All 5 Slatton siblings have had bariatric surgery since the series premiered in 2020, and it's Brittany's turn. Brittany has appeared on the unscripted show since its 2020 debut, alongside her husband, Chris. Over the years, as her famous in-laws lost significant amounts of weight, Brittany quietly pursued her own health and fitness goals. She's also been around for all the Slattons' big life events, so she's a crucial part of the unscripted series. Now she's ready to take a big risk and go on her own personal weight loss journey. Read on to learn more about the signs that Brittany will have bariatric surgery during 1,000 Pound Sisters Season 7. 1,000 Pound Sisters stars Chris and Brittany met while working at McDonald's. In 2012, Chris accepted a manager position at the fast food joint and immediately connected with Brittany, a fellow McDonald's manager. They formed an instant friendship, which later turned romantic. In 2016, Chris proposed, and Brittany said yes. Since the show premiered in 2020, Brittany has been by her husband's side during his weight loss journey, and now it's her turn. Chris and Brittany were married on October 15, 2016, 4 years before 1,000 Pound Sisters started airing. In October 2023, Chris posted a wedding photo to Instagram with the caption, "7-year day. I say do, and wouldn't change anything about this life journey we are on together." Chris's positive attitude and happy-go-lucky approach to weight loss made him a fan favorite, as has his love for his wife. During an early 1,000 Pound Sisters Season 7 episode, Brittany shocked everyone by announcing her intention to have bariatric surgery. Though Brittany is always around while filming, she rarely speaks up, so this was a big deal. She told her husband that she was finally ready to have bariatric surgery, like all the Slatton siblings. It remains to be seen if the surgery will happen this season, but there are signs that it could. During the premiere of 1,000 Pound Sisters Season 7, a tearful Brittany talked about her reproductive challenges, and it was heartbreaking to hear. She says she always wanted to be a mother, but she hasn't been able to get pregnant. Brittany thinks it's her weight that's holding her back from her dreams of motherhood. She tells Chris that she wants to have bariatric surgery so that she can finally be healthy enough to have a baby. Brittany wants to lose weight so she can have a baby, which is reminiscent of how Amy Slatton's weight loss journey began. When Sister Wives premiered in 2020, Amy weighed over 400 pounds. She was a newlywed who wanted children, so she had bariatric surgery and quickly lost 125 pounds. Though her doctors asked her not to get pregnant too soon after surgery, Amy disregarded their warnings. She gave birth to 2 healthy boys, Gage and Glenn Halterman. Brittany hopes to achieve a similar outcome. "Now that I'm fully healed from the surgery, I just want to go try anything and everything that I haven't been able to do in the last 40 years. Though Chris and Brittany have no children together, Chris is a proud grandfather. In January 2022, he posted a birthday photo to Instagram. In the photo, he and Brittany hold an adorable little boy between them, and they're all wearing matching birthday shirts that indicate it's his grandson's birthday. Though Brittany isn't the child's biological grandmother, she's wearing a shirt that identifies her as the birthday boy's grandmother. Brittany loves Chris's children and grandchildren as if they were her own, but she'd also like to have her own biological child. At 44 years of age, Chris is older than the 36-year-old Brittany. Though Chris and Brittany's age gap never got in the way of their marriage, it could be a problem when it comes to having a baby. At 44 years of age, Chris would be starting all over again. During the premiere episode of 1,000 Pound Sisters Season 7, Chris pointed out that his baby would be younger than his grandchildren. Despite how challenging it is to have a baby now, Chris loves his wife and wants to give her what she wants. Seeing how successful weight loss surgery has been for her husband has inspired Brittany to go on her own journey. Chasing a baby around is hard, and it only gets more difficult with age. Chris may not have as much energy as he used to. On the other hand, he has lost a lot of weight, so he may be more energetic now than he was when his other children were young. The 1,000 Pound Sisters Season 7 star has changed his life completely, and he even ran a 5K since losing weight. Having more children may not be easy for Chris, but it wouldn't be out of the question. He is determined to give his wife the baby she wants. Over the years, Brittany has attended her fair share of doctor's visits with her husband. She was there when Chris had his own bariatric surgery, and, more recently, she was by his side for his skin removal surgery during 1,000 Pound Sisters Season 6. While Chris lay in his hospital bed after the surgery, he said, "This is the best journey that I've ever decided to take and stick with." Seeing how successful weight loss surgery has been for her husband has inspired Brittany to go on her own journey. Chris has been there for his siblings during each of their surgeries, and now he may get the chance to be there for his beloved wife. Though Brittany has been by her husband's side during his appearances on the show, she's been getting way more screen time during 1,000 Pound Sisters Season 7. Her newfound storyline suggests that her season will end with Brittany being rolled in for bariatric surgery. Chris has been there for his siblings during each of their surgeries, and now he may get the chance to be there for his beloved wife. Tammy Slatton, 38 years old, lost 500 pounds. Amy Slatton, 37 years old, lost 169 pounds. Chris Combs, 44 years old, lost 150 pounds. Amanda Halterman, 43 years old, lost 31 pounds. Misty Slatton Wentworth, 48 years old, lost 74 pounds. Brittany Combs, 36 years old, unknown. Fans of 1,000 Pound Sisters have watched the weight loss journeys of Amy and Tammy Slatton for years, but now another family member may be stepping into the spotlight. Brittany Combs, the sisters' cousin, has been featured on the show and has struggled with obesity alongside them. With Tammy's incredible transformation after bariatric surgery and Amy's own ups and downs, viewers are wondering, will Brittany follow in their footsteps and undergo weight loss surgery this season? Here are 5 compelling signs that suggest Brittany Combs may be preparing for bariatric surgery in the upcoming episodes. 1. She's openly discussed her weight struggles. Brittany has never shied away from talking about her weight issues. In past seasons, she has expressed frustration with her inability to lose weight through diet and exercise alone, a common struggle for those with extreme obesity. Past attempts. Like Amy and Tammy, Brittany has tried various weight loss methods, but may have hit a plateau. Emotional confessions. In recent episodes, she has been more vocal about her fears regarding her health, a key indicator that she may be considering surgical intervention. If Brittany continues to open up about her struggles, it could foreshadow a major decision regarding surgery. 2. She's seen consulting with doctors. One of the biggest signs that a 1,000 Pound Sisters cast member is preparing for bariatric surgery is medical consultations. Tammy and Amy both went through extensive evaluations before their procedures, and Brittany may be doing the same. Clinic visits. If Brittany is seen meeting with bariatric specialists or undergoing tests, such as sleep apnea studies or heart evaluations, it's a strong hint that surgery is on the table. Therapy sessions. Many bariatric programs require psychological evaluations to ensure patients are mentally prepared for the lifestyle changes post-surgery. If Brittany is shown in therapy, it could be part of her pre-op process. 3. Family encouragement and Tammy's influence. Tammy's 100-plus pound weight loss after bariatric surgery has been a major inspiration for the family. Brittany has seen firsthand how the procedure changed Tammy's life, and this could motivate her to take the leap. Peer pressure in a good way. The Slatton family often pushes each other toward healthier choices. If Amy and Tammy encourage Brittany to consider surgery, she may be more likely to go through with it. Success stories. Seeing Tammy's ability to walk, travel, and enjoy life post-surgery could be the final push Brittany needs. 4. Signs of pre-surgery weight loss efforts. Before undergoing bariatric surgery, patients are often required to lose a certain amount of weight to reduce surgical risks. Brittany may be shown following a strict diet. If she's seen cutting out sugary drinks, fast food, or following a liquid diet, it could be part of her pre-op plan. Increased physical activity, walking more or attempting light exercises could indicate she's preparing her body for surgery. These efforts would align with the typical pre-bariatric surgery process seen with Amy and Tammy. 5. Dramatic health warnings. 1,000-pound Sisters doesn't shy away from showing the harsh realities of extreme obesity, and Brittany's health could be reaching a critical point. Doctors' warnings. If physicians tell Brittany that her weight is putting her at risk for heart disease, diabetes, or mobility loss, she may have no choice but to consider surgery. Scary moments. A health scare such as difficulty breathing or severe joint pain could be the turning point that pushes her toward surgery. Will Brittany get surgery this season? While nothing is